Hello everyone, and welcome to Pharmaceutical Biostatistics course, Lecture 1 Descriptive Statistics. In this phase lecture, we will begin with the basics of descriptive statistics, which form the foundation for all further statistical analysis in health and social sciences. So let us get started and take the first step into the world of biostatistics. Here the outline of lecture. We will cover population and sample, types of data and variables, scales of measurement, frequency distribution, measures of central tendency, measures of dispersion, and the properties of distributions. So these topics will give you a solid foundation in descriptive statistics. Let's start with a basic question. What is biostatistics? Biostatistics is a branch of mathematics that helps us works with data, especially in fields like medicine, pharmacy, and biology. It involves several steps: collecting data, organize it, analyze it, interpret the results, and finally present it in a clear way. So biostatistics is the application of statistical methods to biological, medical, and pharmaceutical data. It helps us collect, analyze, and interpret data to make decisions in healthcare and research. And also, the word statistics has another meaning. Sometimes it refers to numbers themselves, like averages, percentages, or relationships between variables. In pharmacy, we use biostatistics to understand drug effects, evaluate clinical trials, and make evidence-based decisions. So, for example, suppose a company develops a new drug to reduce blood pressure. So we collect data from patients and we analyze whether the drug works, and we interpret if the results are significant. Then we present the findings in reports or graphs. This entire process uses biostatistics. So in simple terms, biostatistics helps us turn medical data into meaningful decision. Now let's move to an important question. What exactly do biostatisticians study? Biostatisticians analyze data related to health and disease. Their goal is to understand what causes diseases, how they spread, and how we can reduce risks. They study diseases and disorders, but they don't stop there. They also investigate risk factors, such as behaviors like smoking or unhealthy diet, and environmental factors like pollution or contaminated water. So biostatistics helps us answer questions like, why do some people get sick while others don't? And how can we prevent diseases? For example, we use biostatistics for studying the relationship between smoking and lung disease, or analyzing how air pollution increases asthma cases, evaluating whether a drug reduces symptoms to diabetes or symptoms of diabetes, identifying risk factors for heart disease. So biostatisticians don't just study diseases, they study the causes and risks behind them to improve public health. Statistics can be divided into two main types: descriptive and inferential statistics. First, descriptive statistics. This type is used to organize, summarize, and present data in a meaningful way. For example, we can calculate the average create tables or draw graphs. But here the key point: descriptive statistics only describe the data we have. It does not make predictions. Now, let's move to inferential statistics, which is more advanced. Here, we use data from a small sample to make conclusions about a larger population. This includes methods such as point estimation, interval estimation, and hypothesis testing. All of these are based on probability theory. So, in simple terms, descriptive statistics tells us what the data shows, while inferential statistics helps us decide what it means. For example for descriptive statistics, we measure the average blood pressure of 50 patients taking a drug. But in inferential statistics, for example, we use those 50 patients to conclude whether the drug works for all patients. So descriptive statistics summarize data, while inferential statistics helps us make decisions beyond the data. Now let's discuss two very important concepts: population and sample. A population is the entire group of individuals or objects that we want to study. For example, all patients with diabetes in a country. Populations can be of two types. Finite, meaning they have a limit number. But infinite population, meaning they are very large or cannot be counted exactly. Now, a sample is simply a subset of that population. In real research, we usually do not study the whole population. We select a sample. But why do you use sampling instead of studying everyone or studying population? There are several reasons. The first one, it is very expensive to study the whole population. And the second one, it requires a lot of time and efforts. And sometimes results may take years if we study everyone or we study population. So sampling helps us save time, cost, and still make reliable conclusions. For example, suppose we want to study a new drug for diabetes. Population means all diabetic patients, but samples, for example, we have 100 patients selected from or for a clinical trial. So we study the sample and then apply the results to a population. In this slide, we talk about one of the most important concepts in statistics: data. Data is the raw material of statistics. It can be in the form of numbers, such as blood pressure values, or text, such as patient symptoms. Before we analyze anything, we must first collect data. So, why do we need data collection? First, we collect data to perform analysis and answer research questions. Second, it helps us understand real-life situations, such as disease patterns. And the third one, it allows us to compare different situations, like comparing two drugs or two groups of patients. In simple terms, data helps us move us from guessing to making scientific decisions. For example, suppose we are testing a new painkiller. We collect data on pain levels before and after treatment. We compare results between patients who took the drug and those who didn't. This data helps us decide if the drug is effective or not. So, data is the starting point of all statistical works. Without data, there's no analysis and no decision. Sources of data, where data comes from. In statistics, sources of data are generally classified into two types: primary data and secondary data. First, primary data. This is data that the researcher collects personally for a specific purpose. In other words, it is original data collected directly from the source. There are several methods to collect primary data, such as surveys, questionnaires and personal interviews, focus groups, experiment and observational studies, or even routinely kept records. So, whenever you are directly involved in collecting the data, it is called primary data. For example, suppose you are studying the effectiveness of a new drug. You design a questionnaire for patients, you conduct interviews, or you run a clinical experiments. All the data you collect in this process is primary data. So, primary data is original data collected directly by the researcher to answer a specific research question. Let's move to the second type of data source, secondary data. Secondary data refers to data that has already been collected by someone else for another purpose. It is usually available in the form of finished reports, databases, or records. Instead of collecting data yourself, you use existing data from reliable sources. Secondary data equal to data collected by someone else. It is already available and ready to use. So it saves time and effort. Examples of secondary data source include government records, hospital and clinic records, health department databases, census data, which is an official count of population. So in simple terms, primary data, you collect it yourself. But secondary data, someone else has already collected it. For example, suppose you want to study the number of COVID-19 cases. Instead of collecting data by yourself, you can use data from the health department or hospital records. This is a secondary data. In this slide, we have an important concept in statistics: variables. A variable is any characteristic or quantity that can change from one individual to another. A variable is anything that can change or vary, can be numerical or categorical. For example, not all patients are the same. They have different ages, different weights, different responses to drug. All of these are called variables because they vary. In research, variables are what we measure, observe, and analyze. For example, in a clinical study, we may have age of patients, blood pressure, drug dose, treatment outcome, improve it or not. These variables helps us understand how a drug affects patients. So variables are the key elements we measure in any study. They are what make analysis possible. Variables can be classified based on the type of data they represent. First, we have numerical variables, also called quantitative variables. These are variables that are expressed as numbers. They are divided in two types. Discrete variables, these are countable numbers like number of patients. Continuous variables, these can take any value, including decimals, like weight or blood pressure. Second, we have a categorical variables, also called qualitative variables. These represent categories or groups rather than numbers. They are also divided into nominal variables and ordinal variables. Nominal variables, categories with no order, like gender or blood type. But ordinal variables, categories with a meaningful order, like disease severity, from mild and to moderate and to severe. There's a meaningful order. So the main difference is numerical equals to numbers, but categorical equal to labels or groups. For example, number of patients is a discrete variable, but blood pressure is a continuous variable. And blood group A, B, AB, and O is a nominal variables, because here the order has no meaning. But pain levels, for example, from low pain, medium pain, and high pain, it is an ordinal variable because there's a meaningful order exists. So understanding the type of variables helps us to choose the correct statistical methods for our analysis and our results. So in this slide we have types of data based off measurement. We have two types of data in general, categorical and numerical, and categorical divided into two another type, nominal and ordinal. But here numerical data types divided into another types, interval and ratio. So we will explain by detail in next slide. Now let's talk about the scales of measurements, which describes how data is measured and what kind of analysis we can perform. These are four main scales. First, the nominal scale. This is the simplest type. It only classifies data into categories with no order. For example, gender or blood group. The second type is ordinal scale. Here, the data has a meaningful order, but the differences between values are not exact. For example, disease severity has some levels, mild, moderate, and severe. The third one is the interval scale. This is a numerical data where the differences between values is meaningful, but there is no true zero. For example, temperature in Celsius, 0 does not mean no temperature. Finally, the ratio scale. This is the highest level. It has both meaningful differences and true 0 point. For example, weight or high, 0 means absence of the quantity. So, as we move from nominal to ratio, the level of information increases. So the scale of measurement determines how we analyze and interpret data in research. So the nominal and ordinal data refers to qualitative data and categorical data, and interval and ratio types refers to quantitative or numerical data. Levels of measurements can be arranged in a hierarchical order known as Rion, which stands for ratio, interval, ordinal, and nominal. Rank it from the lowest to the highest level of measurements. This hierarchy shows that each higher level includes the properties of the levels below it. For example, ratio data has all the features of interval, ordinal, and nominal data, while nominal has only basic classification. Understanding this order is important because it helps researchers choose the appropriate statistical methods. The higher the level, like ratio, the more powerful and flexible the analysis, whereas lower level, like nominal, are more limited. In this slide, we have an important concept in organizing data: frequency distribution. A frequency distribution shows how often each value appears in a dataset. In simple terms, it tells us how many times something happens. We can present frequency distribution in two ways. In table form, where we list values and their frequencies, like this table we have, and in a graphical form, such as bar chart or histogram. The main purpose of frequency distribution is to organize raw data into a clear and understandable format. Instead of looking at a long list of numbers, we summarize it into a table that is easy to read. So, frequency distribution helps us transform raw data into a clear and meaningful summary. Now that we understand what a frequency distribution is, let's look at its types. At this stage, we have two main types. First, categorical frequency distributions. This is used when the data is in the form of categories or groups, for example, gender, blood group, or type of disease. Second, raw numerical frequency distribution. This is used when the data consists of numbers such as age, weight, or number of patients. So, the type of frequency distribution depends on the type of data we are working with. If the data is categorical, we use categorical frequency distribution. If the data is numerical, we use numerical frequency distribution. So the type of frequency distribution we use depends on whether our data is categorical or numerical. In the next video, we will explain these concepts more detail, and we will solve examples for more understanding. Thanks for watching. See you in the next video and have a good day.